Welcome to this guide on scientific breathing techniques to lower blood pressure without relying on traditional medication. High blood pressure, or hypertension, affects millions worldwide and increases the risk of heart disease, stroke, and other serious health issues. The good news is that simple, evidence-based breathing exercises can make a real difference. Backed by studies and medical reviews, these methods help activate your body's natural relaxation response, reduce stress hormones, improve blood vessel function, and lower both systolic and diastolic blood pressure. In this video, you will discover why breathing works, the physiology behind it, and step-by-step instructions for the most effective techniques. These practices are safe, free, and can be done anywhere. Consistency is key. Many people see noticeable improvements in weeks with daily practice. Always consult your doctor before making changes, especially if you have health conditions. Let's breathe our way to better health. Understanding how breathing affects blood pressure starts with your autonomic nervous system. This system has two main parts: the sympathetic fight or flight response, which raises heart rate and blood pressure during stress, and the parasympathetic rest and digest response, which calms the body. Slow, deep breathing stimulates the vagus nerve, shifting you toward parasympathetic dominance. This lowers heart rate, promotes vasodilation, widening of blood vessels, and reduces sympathetic activity. When you breathe slowly, especially with prolonged exhalations, it enhances baroreflex sensitivity, the body's ability to regulate blood pressure through sensors in your arteries. Deep breathing also increases oxygen intake, improves heart rate variability, a marker of good cardiovascular health, and can lower stress hormones like cortisol. A 2023 meta-analysis found breathing exercises significantly reduced systolic blood pressure by about 7 mm Hg and diastolic by about 3.4 mm Hg on average, with some studies showing even greater drops. One simple approach is slow breathing at 6 to 10 breaths per minute. This rate maximizes the interaction between your respiratory and cardiovascular systems. Research shows that just 15 minutes a day of slow, deep breathing can lower blood pressure noticeably. Technique 1. Diaphragmatic breathing, belly breathing. Diaphragmatic breathing is foundational. It engages your diaphragm muscle fully, unlike shallow chest breathing common in stress. This technique improves oxygen exchange, strengthens breathing muscles, and directly supports blood pressure reduction. How to do it? Sit or lie down comfortably with one hand on your chest and the other on your abdomen. Inhale slowly through your nose for 4 to 6 seconds, letting your belly rise while your chest stays relatively still. Feel the air filling your lower lungs. Exhale slowly through your mouth for 6 to 8 seconds, letting your belly fall. Repeat for 5 to 10 minutes, several times a day. Practice this daily. Studies show it reduces blood pressure by promoting relaxation and better autonomic balance. Start with shorter sessions if needed and build up. Many people notice calmer feelings and steadier readings within days or weeks. Technique 2, 4, 7, 8. Breathing. Developed by Dr. Andrew Weil, the 4-7-8 method is a quick way to trigger the relaxation response. It emphasizes a long exhalation, which helps lower heart rate and blood pressure effectively. Steps. 1. Exhale completely through your mouth, making a whoosh sound. 2. Close your mouth and inhale quietly through your nose for a count of 4. 3. Hold your breath for a count of 7. 4. Exhale completely through your mouth for a count of 8, with a whoosh sound. 5. Repeat the cycle 4 times initially, building to 8 cycles. Do this twice daily or when feeling stressed. It acts like a natural tranquilizer for the nervous system and can lower blood pressure within minutes for some people. Be cautious if you feel dizzy. Stop and breathe normally. Technique 3. Box breathing, square breathing. Used by Navy SEALs for focus and calm, box breathing equalizes inhale, hold, exhale, and hold phases. This rhythmic pattern stabilizes blood pressure and reduces anxiety. How to practice. Inhale through your nose for 4 counts. Hold for 4 counts. Exhale through your mouth for 4 counts. Hold for 4 counts. Repeat for 5 to 10 minutes. Visualize tracing a square with each phase. This technique balances the nervous system and is easy to do discreetly at work or home. Regular practice improves heart rate variability and supports long-term blood pressure control. Technique 4. Slow-paced breathing and prolonged exhalation. Focus on 6 breaths per minute with longer exhales. Inhale for about 4 to 5 seconds and exhale for 6 to 8 seconds or longer. This prolongs the natural drop in blood pressure that occurs during exhalation. A Japanese study highlighted that just 6 deep breaths in 30 seconds can significantly reduce blood pressure in hypertensive individuals. Combine this with diaphragmatic focus for better results. Practice in a quiet space, perhaps with soft music or a timer. Technique 5. Alternate nostril breathing, nadi shodhana. This yogic pranayama balances the body's energies and calms the mind. It may lower stress and blood pressure through enhanced relaxation. Method. Sit comfortably. Close your right nostril with your thumb and inhale through the left for 4 counts. Close the left nostril with your ring finger, release the right, and exhale through the right for 4 to 6 counts. Inhale through the right, switch, and exhale through the left. Continue alternating for 5 to 10 minutes. Research links it to reduce stress, better heart rate, and blood pressure benefits. It's particularly helpful for emotional triggers of hypertension. Technique 6. Bhramari pranayama, humming bee breath. This involves making a humming sound on exhalation, which vibrates the vagus nerve and promotes deep calm. Sit upright, close your eyes, and place fingers gently on your ears or use thumbs. Inhale through the nose, then exhale slowly while humming like a bee. Feel the vibration in your head. Repeat 5 to 10 times. It reduces stress and can help lower blood pressure. Technique 7. Inspiratory muscle strength training, IMST. For a more advanced, device-supported option, IMST strengthens breathing muscles with resistance. Use a handheld device, available affordably online, that adds resistance on inhalation. Perform 30 breaths per day, 5 to 6 days a week. A 2021 study in the Journal of the American Heart Association showed an average 9-point drop in systolic blood pressure after 6 weeks, comparable to medication or exercise effects. Benefits persisted even after stopping. This is excellent for busy people needing efficient results. Additional tips for success. Practice consistently, ideally at the same times daily, such as morning and evening. Combine with lifestyle changes like a healthy diet, low in sodium, regular physical activity, weight management, and good sleep. Track your blood pressure at home to monitor progress note readings before and after sessions. Start slowly to avoid lightheadedness. Stay hydrated and practice in a safe position. If you have severe hypertension or other conditions, get medical clearance. Breathing techniques complement, but do not replace. Professional advice. Create a calm environment, dim lights, comfortable seating, and perhaps nature sounds. Be patient, results vary, but meta-analyses confirm modest but significant benefits across many studies. Breathing exercises also improve overall well-being by reducing anxiety, enhancing focus, and boosting energy. They work on a cellular level by increasing nitric oxide production, which relaxes blood vessels, and by improving endothelial function. Many types of slow, deep breathing show benefits, so experiment to find what fits your lifestyle. Device-guided options like Respirate have strong evidence too, but simple, unassisted methods work well for most. Thank you for watching this guide on scientific breathing techniques to lower blood pressure naturally. Remember, small daily habits like these can lead to big improvements in your health without medication. Start with 1 or 2 techniques today. Stay consistent and listen to your body. Share this video with anyone who might benefit, and subscribe for more evidence-based health tips. Breathe deeply, live calmly, and take control of your blood pressure naturally. Consult your healthcare provider for personalized guidance. Until next time, stay healthy and breathe well.